and welcome to Medical Insights. My name is Dr. Andy, and today we are going to be talking about severe acute malnutrition. Now, according to the NIH, National Institutes of Health, over 30.9% of children aged 5 and less have died as a result of this condition in 2018 alone. Now, before we get into the topic, watch this.
What is malnutrition? Imagine if our communities are filled with children who are strong, healthy, and well-nourished. Their bodies get enough energy and nutrients to grow and develop well. Sadly, this is not a reality for many children. As you care for the children in your community, you may see that some are not getting enough nutritious food for their bodies to grow properly. This threat is called malnutrition, and if it continues for a long time, it can cause lifelong damage such as impaired growth and developmental delays. Malnourished children are more likely to die than well-nourished children. There are different types of malnutrition, but this module will focus on undernutrition. This is when a child does not get enough nutrients to grow and develop properly. The child can be affected in several ways. First, undernutrition for a short time can cause wasting, which is a low weight for height. They will appear thin. If a child does not get enough nutrients for a long time, this affects their growth and they may be stunted, which means have low height for age. They will look short for their age. Long-term undernutrition can also cause a child to be underweight, which is low weight for age. An underweight child may be wasted, stunted, or both. Severe and continuous malnutrition can lead to kwashiorkor or marasmus. Kwashiorkor is caused by a severe lack of protein. This is often because the child is not eating enough protein, but can be made worse by absorption difficulties if the child has measles or diarrheal illnesses. This lack of protein causes fluid to gather in the body, leading to swelling called nutritional edema. Common signs of kwashiorkor are a round face and a distended or round stomach. Also, look out for swollen feet and legs. Another video will show you how to identify if the child may have kwashiorkor by checking for swelling of both feet. Marasmus occurs when the child has not taken in enough calories and does not have the energy to keep their body working properly. To identify marasmus, look out for a child who is thin, weak, and tired. They may also be short for their age due to malnutrition during their critical growth periods. A video in this module will show you how to determine if the child may have marasmus by a red reading on the mid-upper arm circumference or MOAC tape. By recognizing these signs of malnutrition, you can take steps to get children the support they need to recover from malnutrition.
To help shed more light on the topic is Dr. Nontobeko Khoza joining us today. Hello, Dr.
Good afternoon, Doctor.
Welcome to Medical Insights.
Thank you so much for having me today on the show.
Beautiful. So you predominantly work with children, right?
Yes,
in your day-to-day work. What kind of conditions do you normally come across?
So as you mentioned, that severe acute malnutrition is one of the commonest conditions that we see. We see a lot of prematurity. We see quite a lot of acute gastroenteritis. That's a condition where a child will present vomiting and diarrhea. And we also see a lot of respiratory illnesses, whether it's viral or bacterial.
Interesting. Now, today we are focusing on severe acute malnutrition, and I understand that this is a predominant, prevalent disease, especially in developing countries. But what is this disease?
So, Doc, severe acute malnutrition basically is an illness where the child is not getting adequate nutrition, hence malnutrition. So the nutrition that they're getting is not enough to maintain their bodily activities, and it's not enough to maintain their growth, you know, the requirements for growing as well. And then as a result, there are complications leading to infections and diarrhea and also other infections as
Beautiful.
well.
We'll get into the complication, but I want to understand what generally causes a child to be deficient in nutrients.
So as we rightly said, that the biggest risk to this illness is when the economic status of the family is poor. So there'll be inadequate food intake. So there's an element of the calories not being enough to supply the body for all its activities, but also the quality of the nutrition that the child is getting. You find that the child is getting food, but it doesn't have the right vitamins that the child needs. That the food, it does not have enough minerals that the child needs to grow and for all the other activities of the body. Yes.
I remember that when I was in high school, what one of our lecturers would say, because in most African communities we introduce children to porridge, the one that you use maize meal. They used to tell us to advise parents to put margarine or peanut butter to add nutrients. Would you recommend that?
Yes, so especially, well, looking at the age of the child, obviously that porridge does not substitute milk at the ages between 0 and 2 because they still need milk.
Yeah.
But then after that, let's say a child does not eat enough food. So adding those elements will ensure that even if they don't take all the scoops, whatever scoops has enough nutrition, has enough protein for the child, yes.
Beautiful. Speaking of food, what is the right age of introducing other than milk into the diet of a growing baby?
So we always advise at 6 months. We always advocate for exclusive breast feeding. It's not always possible for all mommies to do that, but we always say at 6 months that's when you can start introducing your other soft feeds, yes.
Interesting. I understand that you mentioned that poor socioeconomic status can be a risk factor for a child to develop severe acute malnutrition, but what other risk factors? Could a child perhaps born immunocompromised? Is that a risk factor? Are there other risk factors?
Yes, there are other risk factors. So some of the risk factors that have been noted are children who already have been born with a low birth weight.
Okay.
So you premature babies or even babies that were already born with a low birth weight. And also the mothers themselves, if you were born by a mom who also has low birth weight, then it also puts you at a risk of you yourself having, you know, malnutrition at a later stage. And then there are certain illnesses that also predispose you to being malnourished, because those illnesses cause your body to use up a lot of energy. Hence, whatever food you take in, it goes to maintaining just the normal, you know, body activities, and not necessarily for you to grow as a child. Yeah.
Wow, I like the low birth weight. Do you perhaps know how that predisposes one to, therefore, malnutrition? All right, the beautiful thing is that you are actually a specialist, and in a few years' time, you also would be understanding that. That's fine. We can pass through that. But now I want to know, at what stage does the child come to you? Do mothers actually bring children in time for the clinician to intervene such that the outcome is good?
So moms are different, and it's very interesting to actually deal with them. Some will come to you when there's no problem at all, because maybe their first 2 children or the children that they've dealt with before were growing in a certain way, and they'll come and the baby's actually fine, then we reassure. Some, because they're knowledgeable or because they've got supportive family members and actually tell them that, no, look out, it seems like the child is a problem, then they will come while it's early for us to intervene. And most of the time, unfortunately, moms come when it's actually very late for us
Yeah.
to actually intervene,
Yeah.
which is why I'm very happy about the program
The
that we're
topic,
having
yeah,
today.
yeah.
Most of them come quite late.
Interestingly, I did my internship over a little 3 years ago, and I can say that that was my experience also rotating in pediatrics, that children that often present with severe acute malnutrition, often they present so late that there's almost little to nothing that you can do. But I also want to know, what are the other symptoms that the children present with? How can the parents look out for these symptoms to say, no, the child is not eating as they should, and therefore they are now presenting like this, and this is of clinical concern?
So most of the time, mommies actually are good at this. You'll notice that your baby is losing weight.
Okay.
Maybe the clothes that you bought like 6 months ago, because we
Yeah.
know babies grow quite quicker than we do.
Yeah.
The same clothes that they wore when they are 12 months, it's still fitting them when they are 2 years. So now you start getting concerned. You know, your baby's always having flu all the time, and
Okay.
whenever they have flu, it takes
Recurrent
quite
infections.
long for them to get over that flu, you know, and you look at other kids in their age group and you're like, you know, my baby is smaller compared to them. Yes, we are all of genetic, you know, differences, but then you will see that, no, my baby is actually growing at a very slower rate. Then you can bring your child and we can help assess and tell you, is this normal for your baby or is there a problem?
Yeah,
Yes.
yeah. Interesting. Like, there's really a lot to say on this topic. However, at this juncture, we're going to have to take a break. And when we come back, we're going to be giving you more facts on severe acute malnutrition. Stay tuned.
This language that we speak in other tongues, they come with stammering lips and another tongue. Sometimes it sounds fully like a language, another tongue. Sometimes it sounds like stammering lips, repetitions of certain sounds. Has that happened to you? Oh, yeah!
Welcome back, ladies and gentlemen. And if you have just joined us, we are talking all things severe acute malnutrition right here at Medical Insights. Now, before the break, we spoke about the risk factors and how a child who has this condition can present. But now, to help us understand a little bit more in terms of pathophysiology, I'm sure that there are those parents that just like to understand disease process. How does this occur? How does this actually happen in the body such that such symptoms become visible?
So we spoke about how most of the time this disease is caused by the deficiency of the nutrition intake. Now, nutrition is very important for a growing child because it helps maintain, number one, the bodily activities, but also it helps the child grow. Like every system needs good nutrition. So now when there's a deficiency in nutrition, how the body regulates everything, like the sugar levels, the energy levels, your immune system, all of that is impaired. So that's why severe acute malnutrition is actually a problem in every system. So that is what happens. It's from the cellular level to every organ in your body that is being affected by that.
Interesting. Because, you know, Pastor often tells us that you are what you eat, literally. And for the baby to grow, like you said, they require those nutrients. Therefore, if they're deficient, they can affect all the systems. Wow, that's quite interesting. So tell us about this affecting all the systems from head to toe.
So we can start maybe, let's say, even from the hair. You will notice that these kids will have sparse hair. The color is not nice, rich and black, especially amongst us African. You'll find that it's like pale, going to brown. Their skin, like most of those kids will come with like breaking out skin, quite flaky because of a deficiency in their zinc levels. Their eyes, they can even come with, you know, scarring of the eyes because of deficiency in vitamin A. You know, going to the head, it's a growing brain. It needs nutrition. So what will happen is that, you know, the cells in the brain themselves, they will reduce in number. And then these kids will have a smaller brain size.
Wait, Dogotela, mentioning the brain size reducing. If you successfully resuscitate a child out of the state of severe acute malnutrition, what is their medical prognosis in terms of neurological, mental function?
So if you intervene in time,
Yeah.
they've got a good prognosis, but
Yeah.
also depending on how they present it. Because as we said, that some of the moms or some of the caretakers, they come in quite late.
Yeah.
But if they come in time, or we are fortunately able to resuscitate them
Yeah.
through rehabilitation,
Yeah.
we are able to help the child actually
Yeah.
get to their expected, abilities
Yeah.
as a child,
Yeah.
yes.
Beautiful. Yeah, you can continue. You were on the head and the eyes.
So as we were saying that because of poor nutrition, there'll be less brain cells, a smaller brain. That will affect their milestones. It will affect how they interact with other kids. You'll find that they're very irritable. They're not playing, and so that's a
And
big
I
thing.
think not playing for a child is a concern for anything, because children are energetic for days.
Yes. That's the number one thing you should look out for as a mom.
A child that is not playing is a call for concern.
And then earlier on, we spoke about how, how the body regulates, itself. We are talking about your endocrine system now, how, you use sugar, your glucose in your body. These kids will have a lower level of glucose. You come to your stomach or your bowel, the lining is not the same as healthy kids. So now they are prone to infections. They are prone to having diarrhea. You come to the bones itself, that deficiency of vitamin D,
magnesium, calcium.
all of that, So basically every system in the body, for a child needs good nutrition. And when a child has severe acute malnutrition, every system is literally affected.
And also you speaking about affecting all the systems and the energy levels being down. I mean, for us to maintain homeostasis and all the energies in the body, you need glucose. So without glucose, it also means that you're not producing enough energy and your body won't be as warm as it's supposed to. They are also prone to hypothermia. And once you are hypothermic, it means that all the enzymes are prone to denaturing because they work with a certain pH, certain temperature. So it's really not a desirable state. And also because a child is still growing, their immune system is also still developing and everything. So Dokotela, finally, how do we treat this disease medically?
Okay, so we talk about the WHO 10 steps, which is just basically a guide.
Are we still using those steps? They were taught to us when I was in final year, which is like 5 years ago. So I thought maybe there's like new developments. So we still follow those 10 steps.
There are obviously new developments, but we are still using they are still fundamental to the treatment. And basically, we divide the management into the stabilizing of the patient as they present. Because remember, we said that now it affects every system. So we stabilize, we look at what can actually affect the baby detrimentally now. We spoke about the sugar levels, we spoke about how they can't regulate their own temperatures. So these are things that when the baby now, most of them, they can come in with diarrhea, as we spoke about their lining in their stomachs. So we manage that, make sure that they are well hydrated. And then also we need to find out what caused this problem. We spoke about how it is common, in poor socioeconomic status households or, in developing countries. So we need to help, if there's poor or lower income, then we need to step in that.
Also to the departments like social work and so forth,
And then we need to stimulate the babies, as we said, that because previously they were not energetic, they were not playful. This is where our allies will come in, our occupational therapist, our physiotherapist, and a very big part of the management goes into nutrition, right? So we need dietitians who will help us calculate their bodily requirements per day, as they are making improvements.
Wow. All of this from malnutrition to now a child being managed by a multidisciplinary team. I think that's a lot. You understand? And I think it reminds me of what our man of God, Pastor Chris, always tells us, that every child is your child. And it takes a village to raise a child. literally. And I think that is also why we have the likes of inner city mission to bridge that gap, to be a parent to that child who possibly didn't have a parent. So I want to know, you mentioned there was lack of nutrition. Now we are on a journey of bringing in nutrition. How do you, in the process as clinicians, avoid refeeding syndrome?
Okay, so as we spoke, or rather, like refeeding syndrome is one of the complications that can come with, correcting the nutritional status of the child. Basically, what happened is because this child has been so used to being starved, now you are coming in with nutrition. Now you are coming, in with so much energy or calories. So what happens is that the body, it's just too much for the body to handle. Then what happens at the cellular level is that there's a decrease in calcium, there's a decrease in phosphate, all these important electrolytes that are actually fundamental for some of the important organs, such as your heart, such as your lungs, to function. So they can, they can complicate because of that, and unfortunately some can actually die. So you'll find that the child was improving, and then all of a sudden it's like, what happened? And then there's that deterioration. So to prevent refeeding syndrome, we work hand in hand with the dietitian, and that's why I said they are very key, because they will guide us to say, no, today, because the baby looks like this or their status is like this, these are the calories that they can handle today. This is the supplementation you can give today. They are not ready for this. Okay, now you can give them solid foods. So dietitians are key.
Interesting that you've mentioned also some of the complications that could potentially occur as a result of SAM not being treated. Any other complications, like heart complications, I read, due to fluid overload and so forth?
I think mostly it's the refeeding syndrome, and also just being vigilant of excluding other infections, because when the child came in, they were malnourished, their immune system was weak. So the body could not actually show you that, there's an infection in the body. So they might come in, with hypothermia. Usually when a patient has an infection, you expect them to have a fever. So they won't have that, They
present atypically.
Yes, they present atypically. So as a clinician, you need to be aware of that and be ahead of that in terms of treatment,
Wow, I think there's still so much to unpack from this topic, but this is all the time that we have for today. So before we let you go, Dokotela, final words to the mothers at home.
I think I will just re-echo what you said, that, our man of God has taught us that every child is your child. We cannot, shut our eyes to what we are seeing. If you are seeing a child in your community, in your family, who's malnourished or who has any other problem, encourage the caretaker to bring them in for help. And also remember that we are not just body, we also have, we are spirit first. So that's where you start. Feed the child the word of God. Thank you so much.
Absolutely. Feed the child the word of God, and every child is your child, and that is the message from today's show. Dokotela, thank you so much for gracing us with your time and knowledge. We are super grateful. And to you, our viewers at home, thank you for tuning in. Until our next episode, stay blessed and definitely stay healthy.